I am Community Clo, keeping it all things community. Joining me on the show is Rashida Woods, a physician in the Pediatric Emergency Department at the Children's Hospital of Richmond at VCU. Let's talk about strokes. How common are strokes in kids, and who is most at risk?
Strokes in children is actually pretty rare. So if you were to take about 100,000 children, about 1 to 13 of those children would have suffered a stroke. But while it is rare, it is important to know that it is a top 10 leading cause of death in children. And so it is definitely something that we don't want to miss. Yeah, and so in terms of risk factors, children who are born with heart disease or who have had heart surgeries in the past, and then children who later develop heart disease, children who have diseases that make them prone to clotting like lupus, children with diseases like sickle cell, and very young infants who have had infections like meningitis.
What are the signs to look for, and what should parents do if they notice these signs, Dr. Woods?
So the signs and symptoms are very similar to what we see in adults. The inability to move one side of the arm or one side of the face, difficulty talking, difficulty walking, changes in speech. Some children may even present with a seizure as their first presentation of a stroke. So if family members, teachers, anyone out in the community sees these signs or symptoms in a child, please call 911 and get that child to the nearest emergency department so they can be evaluated for a possible stroke.
Of course, at the Children's Hospital of Richmond at VCU. Where can my listeners find more information about pediatric stroke care?
So you can find it on our website at chrichmond.org.